Hi, my name is Dr. Stephen Walker with the Equine Medical Center, here to talk to you today about dental needs of horses. We typically refer to that as floating teeth. This is the most commonly neglected thing that I find among horse owners, even among good, experienced horse owners. I think it's partially because they just don't see it. And I also think it's partially because their teeth are fundamentally different than our teeth. So people can't really conceptualize that it's something their horse needs attention on. A horse's teeth are like a rabbit's teeth. They grow continuously, and the edges of the teeth that are in contact with another tooth are constantly getting ground down, but the shape of the horse's head is such that the outside teeth aren't in contact with anything, and neither are the inside of the bottom teeth. I have a couple skulls here that'll help show that. And I think if the camera can pick up and look right down the skull, you can see that the upper teeth are wider than the lower teeth. So they meet like this at an angle. And that's on purpose so that they can shear their food like scissors. So the occlusal surfaces, or the surfaces that are in contact with another tooth, are constantly getting ground down, but the outside edge of the upper teeth and the inside edge of the lower teeth are not in contact with anything. So that's how you sharpen a knife. You take a grindstone and hold the edge of the knife over the edge and grind it, and that creates a very sharp edge on your knife. And it creates a very sharp edge on the horse's teeth. Also, when you put a bit and bridle on a horse, you'll see that the bit sets right here and the bridle comes right down across these teeth. So when we ask for collection in the horse and ask it to bend at the pole, we're putting pressure on the bridle as it goes across these teeth. That's pushing on these sharp edges, and it hurts your teeth, hurts the horse. So from a performance standpoint, often I have clients who want their horses floated twice a year, just to keep that very smooth and comfortable for the horse being ridden. From a medical standpoint, most horses can suffice with getting floated once a year, but pretty much every horse will need it once a year. Occasionally I'll find a horse that can skip a year, but it's really not very common. I've got pretty much every dental abnormality possible in this particular skull. This is a horse that was euthanized probably 10 years ago for colic, and that's one of the biggest reasons that I feel like one of the biggest contributors to colic is bad teeth. Horses don't chew properly. They eat hay, big stemmy pieces of hay. And if your teeth hurt, you only chew it 10 times and you're left with a stem that's this long. If your teeth don't hurt, you chew it more and you end up with little pieces this long. So if you think of the digestive tract like a drain, and you're flushing pieces of hay this big down the drain, and the other drain you're flushing pieces this big down the drain, this is the one that's going to clog your drain. And it's just a fact that when we have horses that are well floated, they have much less incidences of colic. Sorry about that. So I'll get my float here in a minute and show you the tool that is used to grind these sharp edges off. So I'm going to get a different skull here on a more normal horse. This horse has smooth edges of their teeth, and this horse has been floated before death, and the inside edges are very smooth and the outside edges are very smooth. There are no real abnormalities that have to be corrected here, malocclusions we call them. This is just a horse that needs floated once a year on the outside edges. So the way we do that is we take our float. We at the Equine Medical Center have a power float, and it is just a little carbide bit burr that's attached to a drill, and that turns, and it doesn't hurt soft tissue, but when you put it on bone, it will grind it off. And we just apply the float down the edges of the teeth and take off those sharp edges all the way to the back. We do this under sedation, partially because it allows us to do a much better job. We put a full mouth speculum in the horse that holds its mouth in this position. They don't, it doesn't hurt them, but it is a big metal apparatus in their mouth. So we don't want them shaking their head and hitting somebody with it. So we sedate them to make it easier on them and easier on us. I feel like using a full mouth speculum is a requirement for a good float, really. There's no way you can get to these back teeth without using a full mouth speculum. Some of the dental abnormalities that we find are exemplified in this skull. If you look at it from an angle, go this way. You see the big hook that's on this tooth? We call that a rostral hook, and that's because this tooth is not in contact with the bottom tooth. So remember, they grow all the time. So if it's not in contact with something, it's going to grow. And I can tell, and you can see that if this horse were alive and actually had soft tissue here, this tooth probably had a hole in this soft tissue, because every time it bit down, it was grinding there. Now, some of the old-time indicators that people would use to decide if their horse needed floated was dropping grain. Old-timers would call that quitting. Wallering hay in their mouth while they're eating, dropping out little balls of hay that look like a chewed tobacco. And those are all signs that your horse needs floated. However, every day I see horses that have terribly bad teeth and aren't doing any of those signs. Being skinny is another indication. That's one of the first things we look at on a horse that's lost weight. But I've seen horrible teeth in big fat horses. So something that really should be examined carefully at least once a year should probably get floated. So back to some of the abnormalities. One of them in there is we call wave mouth. And you can see that there's a wave pattern. These teeth, if you look at this normal skull, are supposed to be smooth and straight. And on the abnormal skull, you can see that there is a wave. And that allows for these teeth to have abnormal wear patterns. Also, when a horse eats, it needs to move its head a little bit side to side. There needs to be a little bit of excursion there. And that wave tends to lock their mouth in, and they can't move their jaw in a normal chewing fashion. Way back here would be a good example of why we need a full mouth speculum. This is in the far back of this horse's mouth, and you can see this was a Tennessee walking horse with a great big head. So we've got a long way back here. You wouldn't even be able to see that without a full mouth speculum. And here's a gigantic tooth that has just eaten away at this tooth here. And again, that's because basically the top jaw is set forward, and that's the reason this tooth's not hitting anything here, and this tooth's not hitting in a normal location here. Another thing that we see with some of our geriatric patients is they lose teeth. So these teeth are continuously erupting. So over time, teeth just fall out. They just grow out of their teeth. And that's a normal process. This horse, I think, was about 25 years old or so, but she had lost a tooth right here. And the reason I know that occurred prior to death, the teeth get loose and fall out after the skull sit around for a while. But you see these upper teeth, there's an overgrowth here. And that's what happens is that the teeth that don't have anything to grow against grow down into the socket of where the tooth was come out. Again, that sort of locks the horse's jaw in place. It can't chew normally. And given enough time, this will grow all the way down and hit the horse's jaw down here. So that's just some of the reasons and benefits for having your horse's teeth floated. Floating is included in our wellness plan here at the Equine Medical Center. We have a plan that includes all of the vaccinations, teeth floats and parasite control that your horse needs for a year, give us a call.